thought one of the interesting points in, I believe it was the interview that you did, or maybe it was one of Benno's other interviews, but I reviewed a couple in preparation for this, and he was talking about that seminal article he wrote about the paradigm shift from, the normal kinematics line up to vertical. I guess it was in about 2001 or so that he wrote that, and that coincided very closely with the barefoot running movement. And that's actually how I first came into contact with Benno. He was one of the voices of reason in that that whole big thing with Chris McDougall. And in my search with some of the stuff you did, guess what? His TED Talk cross-referenced in the Google search as I was looking for some past biomechanics stuff. And I have to say, even back then, it was just so romanticized. And the only, I think, silver lining to the whole thing, in my view, was that it brought great attention to biomechanics. Podiatrists certainly saw a lot of foot pathology as a result of overzealous Clydesdale class runners running down the street with their 5 fingers. So it did create a lot of discussion. But as you mentioned, and I'd be interested in some of your talks with Kevin Kirby. How does he reconcile? I know you believe in the Kirby Skive. I still use it in my models, and I don't think you're necessarily downplaying that at all. But the whole idea of how we were getting things traditionally to vertical, and how does and I know he keeps very, very much abreast with what's happening in the world of biomechanics, but from conversations you've had, how has that shifted his view, and how does something like the Kirby Skive integrate with that? I certainly like the idea of, from a functional standpoint, you can have a very low profile orthotic and have that built right into the cant of the orthotic. So maybe give me a little perspective there.
Sure. Kevin's a very good friend of mine. He and I have the world's oldest and arguably best boy band. It's called the Tarsal Coalition. He's the lead singer, so obviously he's very temperamental. I'm the guitarist, so I have to put up with his antics. Kevin is a guy. It's quite difficult to change his mind on some things. Now, I love the Kirby Skive. I think it appeals to me because its whole idea is that it's looking at changing force or load or stress. And it does that because it provides a supination moment right at the level of the sustentaculum tali. And so this large angle provides a very specific counter movement within the orthotic device. So I think that's a really important way to look at this, rather than just trying to grab a heel and move it to vertical, because of course you can't do that. You've got too much fatty tissue. You can't do it with an orthotic, and you can't do it with a shoe.
I just want to give people a quick visual. Here is the sustentaculum tali for the non-anatomical folks that may just be lay people taking a look at this. And that is a critical point, as we discussed off camera, about how orthotics are addressed. A lot of my patients think it should be right there, but you'll get an orthotic back, and sometimes the rise of the arch is more proximal. Anyway, continue.
Yep, that's exactly right, and I think that's what I like about it. That it does provide this fairly steep angle, a little more distally than a traditional orthotic device, and so it does offer that quite important counter rotation movement underneath that shelf of bone, the sustentaculum tali. So you really are getting potential to really try to do something important with the device.